If you're exhausted, pale, out of breath walking up a single flight of stairs, and your periods are so heavy that you're planning your life around them, this video is for you. Heavy menstrual bleeding and iron deficiency anemia can quietly drain your energy for months or even years before anyone joins the dots. Today, we're going to do exactly that, using clear NHS-based guidance so you can understand what's happening in your body and what you can do about it. You'll hear what heavy actually means in practical terms, why it can lead to anemia, what you can safely do at home, when to see your GP, and when you need urgent help. By the end, you'll have a straightforward, step-by-step plan you can act on, rather than guessing or simply putting up with it. Welcome to Balanced Woman UK, where we focus on evidence-based women's health you can trust. Everything we'll talk about comes from official NHS guidance, the Royal College of Obstetricians and Gynaecologists, and NICE, and you'll find all the sources linked in the description below. As you listen, keep your own symptoms in mind and gently compare them to what we cover. The aim here isn't to scare you, but to give you language and structure so that if this is affecting you, you can finally move from feeling stuck and dismissed to feeling informed and supported. Before we get into definitions and tests, it's important to say this clearly. If your periods are heavy, you're not alone, and this isn't a personal failing. Heavy menstrual bleeding is very common, and there are effective treatments. You do not have to just put up with it, and you don't have to wait until you can barely function to ask for help. If you're worried about anemia or your periods are taking over your life, there is a clear, stepwise route to get checked, treated, and back to feeling more like yourself again. So let's start by grounding everything in one simple question. What actually counts as a heavy period? To make sense of whether your bleeding might be heavy, it helps to move away from milliliters and numbers and instead focus on impact. The NHS definition is very practical. Heavy menstrual bleeding is bleeding that is excessive for you and interferes with your quality of life. That means you don't have to be measuring cups of blood. You're looking at how your period changes your day. If you're constantly checking where the nearest toilet is, saying no to plans, or building your month around those danger days, that's already an important signal. Some specific signs can help you recognize this more clearly. You might find you're soaking through pads or tampons every 1 to 2 hours, needing double protection such as a tampon plus a pad, passing clots the size of a 10p coin or larger, or bleeding for more than 7 days. You may have to change protection during the night to avoid leaks, or you might be avoiding normal activities like exercise, social events, or travel because you're worried about flooding. A useful question is whether you regularly wear dark clothes just in case, or plan your day around bathroom access rather than your own preferences. If that sounds familiar, your bleeding is affecting your life enough to be taken seriously. Heavy bleeding isn't just an inconvenience, it has real physical consequences because blood contains iron. Every period involves some blood loss, and your body is built to cope with that. But when the bleeding is heavy and frequent, the iron you lose can gradually outstrip the iron you take in, even if your diet is decent. Over time, your iron stores can run low, and this is when iron deficiency anemia can develop. Understanding that link between bleeding and anemia is the next step, because it explains why you might feel so exhausted and out of breath even when you think you're just having heavy periods. Once we see heavy bleeding as more than just a nuisance, it becomes easier to understand how it can drain your energy. Each month, your body loses blood through your period. With heavy menstrual bleeding, that loss can be greater than your body can comfortably replace, especially if you're not absorbing enough iron from your diet or if your stores were already low. As iron levels fall, your hemoglobin can drop too. Hemoglobin is the protein in red blood cells that carries oxygen to your muscles, brain, and organs. When there's less hemoglobin, there's less oxygen delivery, and that often shows up as deep, bone-level tiredness. Iron deficiency anemia doesn't always appear dramatically, it can creep in gradually. You might notice fatigue that doesn't shift even when you rest more, shortness of breath with mild exertion like climbing stairs, or feeling dizzy and lightheaded. Your skin or the inside of your lower eyelids may look paler than usual. Some people experience palpitations or a faster heartbeat, more frequent headaches, brain fog, difficulty concentrating, brittle nails, or increased hair shedding. Others notice a sore tongue or unusual cravings. You don't need to have every symptom for it to matter. If you have heavy periods and a few of these signs, anemia is a real possibility. The good news is that anemia is usually straightforward to confirm and treat. Your GP can arrange simple blood tests, typically including a full blood count to check your hemoglobin and ferritin to measure your iron stores. Sometimes they'll add tests like transfer in saturation or CRP to distinguish between pure iron deficiency and inflammation. Once those results are in, the treatment focuses on two things at once: rebuilding your iron stores and reducing the amount of bleeding that's causing the problem in the first place. Before we talk about treatment options, though, it helps to clear up a few myths that might be holding you back from seeking help. Misconceptions about heavy periods and anemia can make people feel they have to tolerate symptoms that are actually treatable. One of the most common beliefs is that heavy periods are just part of being a woman. While heavy bleeding is common, that doesn't mean it's something you just have to live with. There are safe, effective treatments that can significantly reduce your flow and improve your quality of life, and wanting that relief is completely reasonable. Another myth is, I can't be anemic because I eat well. Diet does matter, but it's only one part of the picture. If you're losing blood, and therefore iron, month after month at a rate your body simply can't match, you can still become iron deficient, even if you eat a balanced, iron-rich diet. Thinking, I eat fine, so this can't be anemia, can delay you getting a simple blood test that might explain why you feel so drained. Similarly, you might hear or think, if I'm older, it's normal to have heavy bleeding. Perimenopause can certainly change your cycle, but new, sudden flooding, heavy bleeding between periods, or bleeding after sex are still reasons to be assessed, regardless of age. There's also a tendency to jump straight to specific diagnoses. For example, pain always means endometriosis. Endometriosis is an important condition to recognize, but pelvic pain can come from many different causes, and it's not helpful to assume you know the answer before being examined. Instead, the key is not to dismiss your pain or bleeding patterns. If they're persistent, severe, or affecting your life, they warrant proper assessment. With those myths cleared away, we can look more clearly at the range of possible causes behind heavy and painful periods, and then move on to what you can actually do about them. Heavy or painful periods don't always have a single clear cause you can point to on a scan. Sometimes the bleeding pattern itself is the main issue. In other cases, it's linked to specific underlying conditions. Understanding the possibilities doesn't mean you have to diagnose yourself. It's about giving you context, so conversations with your GP or specialist feel less overwhelming and more collaborative. One common situation is primary dysmenorrhea, which is period pain without an underlying structural condition. It's often driven by prostaglandins, chemicals that make the womb contract. Pain typically starts as bleeding begins and may cause cramping in the lower abdomen and back. The flow can be normal or heavy, but the key feature is regular, cyclical pain tied closely to your period. Endometriosis is a different condition, where tissue similar to the lining of the womb grows outside it, often leading to inflammation and significant pain. Symptoms can include very painful periods, pain during sex, pelvic pain between periods, bowel or bladder symptoms, difficulty conceiving, and sometimes heavy bleeding. Adenomyosis is another possible cause. In this condition, the lining of the womb grows into the muscle wall of the uterus, which can make periods both heavy and painful. The womb may feel enlarged and tender, and it's more commonly seen in people in their 30s and 40s, and in those who have had children. Fibroids, non-cancerous growths in the uterus, can also contribute. Submucosal fibroids, which grow into the cavity of the womb, are particularly linked with heavy or prolonged periods and can sometimes cause pressure symptoms, like needing to pass urine more often. Infections can also play a role, Pelvic inflammatory disease, or PID, is an infection of the reproductive organs that can cause pelvic pain, fever, abnormal discharge, and irregular bleeding. It needs prompt antibiotic treatment to prevent longer-term complications. Your contraception can be part of the picture too. A copper IUD is well known for sometimes making periods heavier and cramps worse, especially in the first few months. In contrast, a hormonal intrauterine system, or IUS, tends to lighten periods dramatically for many people over time. On top of all this, conditions like thyroid disorders, inherited bleeding disorders such as von Willebrand disease, and medications like anticoagulants can contribute to heavy bleeding patterns. It's also important to say that sometimes, even after tests, no specific underlying cause is pinned down. That doesn't make your symptoms any less real or important. In those cases, the focus is still on reducing bleeding, managing pain, and treating any anemia so your daily life improves. With that context in mind, let's turn to what you can start doing for yourself and how medical treatments fit in alongside those steps. When you're dealing with heavy or painful periods and possible anemia, self-care isn't about fixing it all on your own, but about supporting your body and making day-to-day life more manageable while you pursue medical assessment and treatment. It can also give you a sense of control at a time when things may feel unpredictable. Think of it as building a foundation you and your healthcare team can work from, rather than a replacement for professional help. One group of medicines often used is NSAIDs, such as ibuprofen or naproxen. When taken during your period, these can reduce cramping and, in some cases, prostaglandin-related bleeding. They tend to work best if you start them as soon as bleeding or cramps begin and take them regularly through the heaviest days. However, they're not suitable for everyone, especially if you have a history of stomach ulcers, kidney disease, certain heart conditions, or interactions with other medications. So it's important to check with a GP or pharmacist before relying on them. Another medicine to be aware of, though not to start on your own, is tranexamic acid. It's a first-line, non-hormonal option for heavy bleeding that helps blood clot more effectively in the womb lining, reducing flow by up to about half. It's usually taken only on your heaviest days and is prescribed after a proper assessment. Alongside medicines, there are simple physical measures that can still make a difference. Heat therapy, such as a hot water bottle or heat pad placed on the lower abdomen or lower back, can ease cramps and is generally low risk. Gentle movement, like walking, stretching, or yoga, can support circulation and may help with pain perception, as long as you're not forcing yourself through severe pain. Hydration and nourishing foods also matter. Iron-rich foods such as red meat, dark leafy greens, legumes, tofu, and fortified cereals can support recovery, especially when paired with vitamin C-rich foods to boost absorption. Try to avoid tea and coffee close to iron-rich meals, as they can reduce absorption. Another powerful tool is tracking your cycles and symptoms, not to obsess, but to gather clear information. Use an app or a notebook to record how many pads, tampons, cups, or period pants you use, any flooding or clots, your pain levels, and any activities you miss or modify because of your period. This turns a vague feeling of "it's bad" into concrete, shareable evidence for your GP. At the same time, plan ahead for heavy days, double up on protection if you need to, carry spares, and give yourself permission to rest more. That isn't laziness, it's responding to the increased load on your body. One word of caution: if you suspect anemia, it's best not to start iron tablets entirely on your own without a plan to test and monitor. Iron supplements are safe when used correctly, but you want the right dose and duration, and crucially, you need to address the bleeding that's causing the problem. As you begin to recognize patterns in your bleeding and symptoms, it's important to know when to move from self-care to seeking medical support. A good rule of thumb is that if your periods are significantly affecting your daily life, it's time to talk to a GP. That includes situations where you're leaking through protection, needing double protection, changing very frequently, passing clots, or bleeding for more than 7 days at a time. If, on top of that, you have signs of anemia, such as fatigue, breathlessness, dizziness, or palpitations, it becomes even more important to get checked. You should also see your GP if there's any noticeable change in your usual pattern, such as new onset heavy bleeding, cycles becoming much shorter or longer than before, or bleeding between periods. Bleeding after sex or any vaginal bleeding after the menopause always warrants prompt assessment. Pain is another reason to seek help, especially if your periods are so painful that simple measures don't touch it, or if you have pelvic pain outside of your period that's starting to affect your day-to-day life. If you're trying to conceive and also have heavy or painful periods, it's worth being assessed sooner rather than later. And if your copper IUD seems to be causing intolerable heavy bleeding or pain, it's reasonable to go back to your clinician to discuss whether this method is still the right one for you. Alongside these situations, there are times when you shouldn't wait for a routine GP appointment, but should seek urgent help via NHS 111 or emergency services. This includes soaking through sanitary products around every hour for more than a few hours, especially if you feel dizzy, faint, or develop chest pain. Severe lower abdominal pain with fever, vomiting, and foul-smelling discharge can signal an infection and needs quick attention. A positive pregnancy test with heavy bleeding or sharp pain is an emergency because of the risk of ectopic pregnancy. And if you feel as though you might faint, or your heart is racing, and you're breathless even at rest, you should be assessed urgently. If you're unsure, NHS 111 can talk you through your symptoms and help you decide the safest next step. Once your GP has an idea of what's going on, treatment usually focuses on two things at the same time: reducing the bleeding and rebuilding your iron so you can get your energy and your life back. Non-hormonal options include tranexamic acid, which you take only on heavy days to reduce flow, often by up to about half, and NSAIDs such as mefenamic acid or naproxen, which ease cramps and can cut bleeding by around a third. These can work well if you'd like to avoid hormones, but they're not right for everyone, so your clinician will check what's safe for you. Hormonal options are often very effective. The levonorgestrel intrauterine system, LNGIUS, sits in the womb and steadily releases hormone into the lining, usually making periods much lighter and sometimes stopping them altogether after a few months, while also providing contraception. Combined hormonal methods, the pill, patch, or ring, can regulate your cycle and reduce both bleeding and pain, and progestogen-only methods, tablets, injections, or implants, can help some people too, though bleeding patterns can be more variable. If you have conditions like fibroids, adenomyosis, or endometriosis, your team may combine these treatments with more targeted approaches or refer you to gynecology for further options. Treating the anemia itself is just as important. Most people start with oral iron tablets, taken for at least 3 months after blood levels normalize, so that iron stores are fully replenished. Side effects such as constipation or nausea are common, but can often be eased by taking iron with food or on alternate days if your clinician agrees. If tablets aren't tolerated, don't work well, or your anemia is more severe, intravenous iron may be recommended. The overall aim is to pair a treatment that lowers your bleeding with iron replacement, then review things regularly until your blood tests, energy, and day-to-day life are genuinely improving. While you're waiting for appointments or results, there are a few simple checks that can guide your next steps. If you're regularly falling asleep at your desk, needing naps most days, or feeling breathless climbing stairs or chatting while walking, that's a strong reason to ask for a blood test to check for anemia. For your next period, do a brief audit of your heaviest day, how often you change pads, tampons, cups, or period pants, whether you're changing every 1 to 2 hours, whether you pass clots or have leaks, and what activities you cancel or change because of bleeding or pain. Even a rough note on your phone can make your symptoms much clearer when you speak to your GP. It also helps to be clear on your goals before your appointment. Do you want contraception? Are you hoping to conceive soon? Would you prefer to avoid hormones if possible? Knowing this up front makes it much easier to ask for options that genuinely fit your life and leads naturally into a shared plan. Your preferences are central to choosing the right treatment, not an afterthought. The same medical options look very different, depending on what matters most to you. If you want reliable contraception and much lighter periods, the LNG-IUS is often a leading choice because it combines both. If you'd rather avoid hormones, starting with tranexamic acid and NSAIDs is completely reasonable. If your priority is more predictable cycles, combined hormonal methods may help, as long as they're safe for you. If you're planning a pregnancy soon, your GP will usually focus on non-hormonal options and on managing any conditions that could affect fertility, such as endometriosis or fibroids. And if a copper IUD seems to have made your bleeding much worse, it's absolutely appropriate to review that choice. Some people do far better after switching to a hormonal IUS or another method. Asking for what fits you best isn't being picky, it's good standard care. Because tests, scans, and referrals can take time, looking after yourself while everything is being sorted is more than a nice extra. It helps you cope and protects your well-being. If you're prescribed iron, ask how to take it in a way that balances effectiveness and comfort. Many people do better taking iron every other day with vitamin C and keeping it away from tea, coffee, and calcium for a couple of hours. To ease constipation, focus on fiber, fluids, and gentle movement, and ask about a mild stool softener if you need it. Try to protect your sleep and stress levels. Regular bedtimes, a simple wind-down routine, and small stretches or heat pads can all take the edge off pain and fatigue. At work or school, it's reasonable to ask for practical adjustments like flexible hours, access to bathrooms, or occasional remote days. Heavy bleeding is a health issue, not a character flaw. If you feel isolated or dismissed, talking to someone you trust or joining a support group for menstrual health, endometriosis, or fibroids can make a real difference. Feeling understood doesn't fix everything, but it does make the journey easier to bear. If painful periods are also part of what you're dealing with, don't stop here. We've made a dedicated video on how to manage period pain and get the best possible care from the NHS, including exactly what to say in appointments and which treatments to ask about.